Namaskar dosto, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist. And you're watching Dr. KK's Med Talks. आज का हमारा Vitamin D talk show है. And we'll be speaking today about Vitamin D. Let's see what our headlines are specifically. Now the WHO, the World Health Organization, has clearly stated that artificial sweeteners are harmful for health. तो अभी तक क्या था, हम अपने पेशेंट्स को इनकरेज करते थे, एडवाइज करते थे टू टेक आर्टिफिशियल स्वीटनर्स इन मॉडरेशन. But now the WHO has come out with a statement that these are harmful. They do not help, and they actually may end up increasing the risk of obesity and type 2 diabetes. So that's something we all should be aware of. Dementia is another problem that is increasing, and dementia के लिए जो बताया गया है, studies have shown that it is social isolation and lack of physical activity which are major contributors. So if you want to avoid or prevent dementia, get out and exercise with other people, build social bonds. Antimicrobial resistance is increasing in the country, and the WHO has brought out the AWARE classification. A for access, WA for watch, and RE for reserve. So all antibiotics now are divided into three: aware, watch, and reserve. So access, watch, and reserve. So we should use the accessible antibiotics more and keep the reserve ones in reserve. With this, let's go to our topic for today. हमारी आज की जो न्यूज़ थी उसमें तो कुछ जेंडर स्पेसिफिक था नहीं. Artificial sweeteners, dementia, and antimicrobial resistance, these affect each and every person on our planet. But there is something special about women, and that is that women hold up half the sky, and perhaps more than that. So let's see a strong lady, someone who is with us today, and let's talk to her about vitamin D, the vitamin for women's health. Warm welcome, madam.
Thank you so much. Thank you, Dr. Kalra, for inviting me, and it is really a nice show. The way it's going on, it is very nice. And today I'll be talking about vitamin D. I'll just share my screen.
Dr. Anita Baxi is a senior gynecologist across the country. And madam, people have logged in to listen to you. वैशाली दोले जी, अरविंदर कौर आपको नमस्कार एंड सत श्री अकाल कर रही हैं. रेखा पिटारा मैडम, विनायक शर्मा जी, अनामिका नु. And the request is English, Hindi में mixed में दोनों में ही आप एक बार हमसे बात करें.
आराम से. I would love to do that. So thank you so much. And today we are going to talk about vitamin D. Vitamin D आजकल तो कुछ अमृत ही हो गया है, और this is known as sunshine vitamin, which we all know, and it is a very important nutrient for women's health, and it is also known as steroid pro-hormone. तो यह केवल vitamin नहीं है, यह basically a pro-hormone है और एक पूरा endocrinological system से control होता है. So we all know that sunshine is very important for vitamin D, and in the skin there is So in skin there is, in our body there is pro vitamin D, which with the help of sunshine is converted to vitamin D3, that is cholecalciferol, and then that is further converted to calcidiol with the help of liver, and some calcidiol we do get from the diet also, almost 5%. So we think that, oh, we are eating so many things, but still you can see it is only 5%. And it is further metabolized to the endocrine pathway in the kidneys, and it is converted to calcitriol. And there are some extrarenal pathways also which help in conversion. And this calcitriol further affects the various vitamin D3 receptors in various tissues. So of course it does have a lot of effect on the bone health, and that is its main function, but it does have effect on intestines, bones, muscles, heart, and also it has a lot to do with immune system also. So the proposed non-classic functions are in the chronic disease prevention, example heart disease, diabetes, cancer prevention, breast, colon, autoimmune disease prevention. So you can see that in every organ of the body, there is some function of vitamin D directly or indirectly. एंड हम डेफिशिएंसी होती है, सफिशिएंसी होती है या इंटॉक्सिकेशन होता है. तो what is deficiency? The deficiency is when vitamin D is less than 30, and if it is between 30 to 60, it is considered a good range, optimal range, or and if it is beyond 150, then it is a toxic range. So, and current recommendation for vitamin D intake for the children below 12 months is that is for the infants it is 400 units, and for adults it is adults, pregnant and lactating women, it is 600 units, and especially above 70, it has been considered we should give 800 units. And it is again, I think women should start taking even earlier because osteoporosis sets in women earlier than the men. So we'll go in details further. And what are the traditional roles? We have already discussed that it is mainly important for bone mineral metabolism, but at the same time, it works with parathyroid hormone for calcium homeostasis. At the same time, it has its effect on kidney, bone, intestine, and it influences the gene expression. And probably it seems that maybe there is some mutation or polymorphism in these genes, and maybe sometime in some people, you whatever vitamin D you give, there is less effect of that. And in childhood, it has been related to schizophrenia, asthma, type 1 diabetes, and rickets. So it's very important that the children they do have adequate vitamin D. Actually, it should start right from the intrauterine phase, and that's why it is very, very important that we give adequate vitamin D to our pregnant women, because it will help not only in lactation, but there are many things that can be prevented. And the vitamin deficiency has been associated with gestational diabetes, preeclampsia, preterm labor, and it has also been found that those patients who had vitamin D deficiency had more cesarean sections. So maybe it has some direct, indirect effects. Maybe they had severe preeclampsia for which cesarean section was required or whatsoever. And there has been some association with bacterial vaginosis also. And we all know that it is important for IVF and PCOS, and nowadays we are regularly supplementing our IVF patients and PCOS patients with vitamin D and calcium. And IUGR has been closely associated. The growth restriction has been closely associated with vitamin D and calcium, and it has been found कि हम यदि उनको calcium और vitamin D देते हैं, तो many times the growth parameters they start improving. And again, in the adult woman, it has been associated with hypertension, cardiovascular disease, type 2 diabetes, obesity, cancer, multiple sclerosis also. And I was reading somewhere that patients who had vitamin D deficiency, they did have abnormal pap smears also. And there was some correlation with HPV also. So maybe that is how it will have some effect on the cancer cervix also. And in the elderly women, especially in women above 60 and 65, the cognitive impairment is there due to vitamin D deficiency, and there may be proximal myopathy, osteoporosis, of course, we all know about it, osteomalacia, and then this is again associated with falls and fractures, and that continuously leads to deterioration of the overall health. So I think it's very, very important that we give vitamin D to all our elderly population. Then fertility, as I've already said, that we are regularly supplementing our patients, IVF patients, with vitamin D, and the PCOS patients. And in animal studies, there it has been shown that those who had vitamin D deficiency, there was reduced fertility. Though in humans, the results are not confirmatory as yet, but the conditions which are associated with infertility, especially the PCOS, I think vitamin D. And even we are seeing a lot of reduced ovarian reserve these days. And in these patients also, if you give vitamin D, at least that deterioration of ovarian reserve will not be there. And maybe sometimes there may be a little bit of improvement. So, and PCOS, we have already seen. PCOS is, we know that it is not only associated with some endocrinological problems and menstrual regulations and ovulatory dysfunction and all those things, but it does have metabolic effect also. So, and these metabolic effects are very, very important, not only in the short term, but in the long term also. So, and that's why people say that PCOS registry should be started. Why? Because it has close association with diabetes and obesity. Waist to hip ratio is higher in these patients. Then there may be dyslipidemia. So all these things are associated with vitamin D deficiencies, especially in metabolic effects of PCOS. So maybe vitamin D may, up to some extent, you can't say that it will just reverse all the things, but it may have some association and maybe a little bit helpful. So supplementation does have positive effect on the outcome of PCOS patients. And even in endometriosis, it has been said that there is some role of vitamin D. And I think vitamin D does have effect on the immune system. And endometriosis, after all, there is some disturbance in the immune system, which leads to a pro-inflammatory state in the genital system. So maybe vitamin D is again has some role because there are so many receptors. So vitamin D receptors may be dysregulated, and that could be one of the reasons. And that's why people are calling that vitamin D has pleiotropic effects, and that could be the thing. And vitamin D deficiency, we all agree that all our pregnant patients, we are regularly nowadays supplementing in with vitamin D, and we all and we are seeing that there is reduced gestational diabetes, especially low birth weight and preeclampsia, and it has also been associated with IUGR. So that is a very important thing. And it has been said that those who are very deficient in vitamin D, they tended to have more cesarean section. So some correlation may be there. So and regularly we all are supplementing our patients with a vitamin D. And in pregnant women, even RCOG recommends that you have to give, I think, 10 microgram. Their doses are different of vitamin D daily to the pregnant women. So the recommendation is that we should give 400 to 600 international units daily. And again, depending on the deficiency, if she is deficient, then of course you have to increase the doses, and that is going to help you long way. And that way it will prevent preeclampsia, because otherwise these days we are able to combat most of the problems during pregnancy, but still preeclampsia, sometimes abruption, these things can really give us bad nightmares and may have very bad results whatever you do. So we want any small thing that can help in prevention, we would like to do that. Then there is high risk of deficiency in women who are elderly. So very important that elderly women, we give higher dose of vitamin D. And calcium loss during pregnancy is also there. So we have to, along with vitamin D, give good calcium supplement. And in women who have darker pigmentation, we all know that if even in Americans, they have done studies, and those who had lighter complexion and those who had darker complexion, there was a difference in vitamin D levels, because with the darker pigmentation, the absorption of UV rays from the sunshine does not get absorbed so well. And I was in a meeting where I met we had lots of international faculty also, and they were all standing in the sunshine in Jodhpur, and we were all avoiding sunshine because we are scared that we will get dark, so we don't want to go in sunshine that often. And they were laughing that we people love sunshine and we love the tan. Having a tan there is considered as beauty, but we people are scared of sunshine because we'll get dark. So maybe we are trying to avoid sunshine, and that is also one of the causes that darker pigmentation, people tend to have less vitamin D. And obesity is again very much associated with vitamin D deficiency. And preeclampsia risk is again there, and there has been some association of vitamin D and calcium metabolism with preeclampsia, and especially in second and third trimester, hypovitaminosis D can lead to problems. Then gestational diabetes, we have already discussed that GTM, especially those who are having poorer glycemic control, they have found that the vitamin D levels were very less. And in the second trimester, vitamin D deficiency was more pronounced in GTM compared to normoglycemic pregnant women. So small things that can help, and a little bit of an effort, and vitamin D is such a non-harmful agent if given within the recommended doses, I think. And if it can help us even 1%, then I would recommend this. So this is that what I was talking, that inverse association exists between primary cesarean section and vitamin D status. So that is very interesting. And vitamin D deficient women delivered 4 times as frequently by cesarean section than those without vitamin D deficiency. So, and there is a correlation of bacterial vaginosis. Maybe that will lead to premature rupture of membranes also. So there are various studies which have shown that yes, these effects are there. Even somewhere I was reading that vitamin D deficiency is associated with abnormal findings on ultrasound in mammography, sonomammography. So that's again important. Fibroids, we know there are reports that in fibroids also vitamin D deficiency has been associated. So, what are the current guidelines for vitamin D intake? Though we talked about it in the beginning, but as per ICMR, in men 600. So most of the men, women, pregnant women, it is 600, and infants it is 400 units, and children again it is 600. So it is easy. 6K everywhere you see all these tablets which have got 6K. So 600 units is very important. 600 we have to keep in mind, and in men above 60 it is 800, and in women above 60 again 800. So these are the doses, so we have to keep this in mind. 400 for infants, for normal adults 600, and elderly it is 800. So again, I would like to thank you all for the patient listening, and I come from Indore Motherhood Hospital. Thank you so much.
Thank you, madam, and we remember your hospitality and your graciousness. Madam, recently, a year ago, she conducted the National Foxy Conference in Indore, and that was at a time when the country was just coming out of COVID. So, in spite of all the challenges, all the main issues that we had with COVID, still it was a wonderful event. So, thank you, madam. Ma'am, lots of questions coming for you and lot of praise also for your topic. तो मैम एक क्वेश्चन आ रहा है कि आप सारी गायनी इतनी आसानी से पढ़ा देते हैं जैसे आपने विटामिन डी पढ़ाया.
जी सर, वो बीच में शायद थोड़ा सा लिंक चला गया था. हाँ.
We have with us Dr. Ramesh Pal Singh Pawar. Sir is a 72-year young pediatrician जो सहारनपुर में रहते हैं, and right now he's in Atlanta in USA enjoying the sunshine there.
So nice.
And also greetings to you from Dr. R.S. Chaudhary. Sir is one of the senior most surgeons of North India. He practices in Karnal, and he also conveys his greetings to you.
Thank you so much.
Dr. Utsav Sahu is a physician from North Delhi. He says any association of vitamin D with subfertility, infertility in women.
Yes, if there has been association, see, directly or indirectly, why infertility occurs. Maybe there is polycystic ovaries, maybe there is endometriosis, maybe there is myoma, fibroids. So all these things indirectly lead to infertility. So, and then again, it has got vitamin D regulates lots of receptor functions, and these receptors may be there are there in the uterus, ovaries. So that may all get affected, and that may be the reason it is associated with infertility. So we are regularly supplementing our patients with vitamin D who have got infertility.
Bimla Kapoor ji, both saying good evening to you. Ma'am, आपने हमें पढ़ाया that you have seen that the risk of GDM, PIH, this comes down when vitamin D is supplemented.
Yes.
So there's a specific question. This we understand that vitamin D should be optimized before we plan pregnancy.
Very good. Preconception counseling is very important if it can be given. See, I'm lucky because I practice infertility and I have lots of IVF patients. So when these IVF patients come to me for preconception counseling, because that is that usually patients get pregnant and then come to us. But these are the patients where I get opportunity to do preconception counseling, and I do like to give vitamin D to these patients.
And then the question is, ma'am, most of the pregnancies are unplanned. So patient comes
Yes.
to us only after UPT is positive, and she has not
Yes.
visited the women's health provider before that. So can we
Yes.
give vitamin D to asymptomatic women? Can we give vitamin D to symptomatic women in first trimester of pregnancy?
Yes, you can give vitamin D to asymptomatic women, and the dose is 600 units, so that should not be a problem. And you can very well give. What happens most of the time, by the time patient goes to obstetrician, she's already in her 12 weeks or 11 weeks, and usually obstetricians start vitamin D from then onwards. But if she comes to you early, you can start in asymptomatic as well as in symptomatic patients. And it is a human we have all been taught that in first trimester avoid medications, so we try to avoid the medications, but if the especially if patient has vitamin D deficiency, please go ahead.
And it is a necessity. If there is symptomatic deficiency or it has been documented, then it would be criminal actually not to give the
Yeah,
vitamin to
not
the
to
lady
give,
and
right.
repeat
Yeah,
it.
definitely. Maybe it will have some association with miscarriage also, so better to give rather than not.
Not to give. विनय गुप्ता जी क्वेश्चन पूछते हैं तो 600 units 400 units is what is available in most calcium tablets, and when you take 60K, that is 60,000 units sachet.
Yeah, yeah,
That
once a
would be,
week, that's
yeah, that is 60,000, that would be once a week. Dr. Pawar sir shares his experience for pediatric age group. They give 400 units up to 6 months and 800 units after 6 months of age.
is it 800 is a little bit more, no, isn't it?
Hmm. Maybe like it's a growing infant, so they need more vitamin D. We'd
Okay,
like to
so
take
it
the
will not
opportunity.
cause any hypervitaminosis or something.
Oral will not cause, ma'am. If
Okay.
at all hypervitaminosis will occur, it will occur because of intramuscular injection, and that also
Okay.
given in high doses, like 6 lakh units once a week, 6 lakh units every fortnight.
One thing I want to ask you, Dr. Sanjay, this why inject in some patients we have to give injection. The vitamin D levels do not go up to some extent, and then we have to give injection, and patient automatically starts feeling better also. So, what is the advantage of injection over the oral preparation?
Injection earlier had more advantages because our mechanism of making vitamin D, preparing
Mhm.
vitamin D was not so good. But now we have better quality technology, and the vitamin D that is prepared, whether you take as capsule or as a liquid formulation, that can be absorbed even without fat. So absorption is much better now as compared to 20 years ago. Still, there will be some people with absorption defects. Somebody might have giardiasis, somebody might have another absorption disorder, and then the vitamin D can't be absorbed. In such patients, IM is needed. IM is quite erratic, but there are many patients of mine also who will come and say that they get a kick out of the injection vitamin D
Yeah, yeah.
after 4 or 5 days. But I think the
I,
same.
recently, I have been given. Recently, my husband forcefully gave me injectable, and he said, "No, probably the absorption is not occurring, so you take that." So,
So that's fine. That's a good option. And earlier we used to use more because the oral preparations were not good, but now the good
mm,
quality preparations are excellent. Another thing we'd like to point out, and Dr. Pawar sir भी कह रहे हैं that जो milk है, whether it is breast milk or animal milk, cow milk or buffalo milk, that is a good source of calcium, but it is a very, very, very poor source of vitamin D. तो vitamin D आपको देना पड़ेगा.
yeah.
Otherwise, जो
That's
calcium है,
what I was thinking. Yeah, that's what I was thinking when in my PPT I have said that hardly 5% vitamin D comes from the diet. So we think नहीं हम तो बहुत दूध पी रहे हैं हम तो ये कर रहे हैं. So that's a myth basically.
yes. तो कैल्शियम आता है, बट कैल्शियम आपके इंटेस्टाइन से, पेट से ब्लड तक पहुंचे और फिर ब्लड से हड्डियों में जाए और हड्डियों में इनकॉर्पोरेट हो जाए, उसके लिए
Hmm.
विटामिन डी चाहिए. विटामिन डी इज द कैरियर जो कैल्शियम को आपके मुंह से या आपके पेट से हड्डियों तक पहुंचाएगा और वहां पे उसको बसाएगा. सो दैट इज व्हाट विटामिन डी इज इंपॉर्टेंट फॉर.
Sure.
चिराग कौशिक जी मैम पूछ रहे हैं, we'll wait for Dr. Pawar sir to answer. Sir is with us. My child is 3 years old, so what is the dose for my child? And Vinay Gupta ji पूछ रहे हैं, sir, Madam Gupta, Mrs. Gupta takes vitamin D and calcium, which is a must, and multivitamin. Sir, she is not overdosing herself with vitamin D, बल्कि जो NIN की recommendations हैं, डॉक्टर आशा मैम का ओपिनियन लेते हैं. After menopause, actually now 1200 milligram of calcium is advised. And वो भी शायद हम लोग नहीं खा पाते, तो I think Mrs. Gupta is on the right track.
Yeah.
60,000 units once a week for about 3 months, and उसके बाद once a fortnight या once a month. And especially अगर मैडम vegetarian है, if Mrs. Gupta is vegetarian, then usually vitamin D will be low, calcium will be on the lower side. And ये calcium vitamin D क्या करता है सर? It prevents falls and fractures.
Yes.
तो basic ये aim है कि हम गिरें भी कम, हमारा बैलेंस बना रहे, और यदि गिर भी गए गलती से तो फ्रैक्चर ना हो. तो ये बचाव के लिए है.
और elderly में actually health deterioration occurs because of falls and fractures. So I think most important to prevent that, and balance should be good. So all those things are important.
Ma'am, lot of people listening to you from in Madhya Pradesh as well. तो नगड़ा जगह है उज्जैन में, वहां से डॉक्टर प्रदीप रावल आपको नमस्कार भेज रहे हैं.
नमस्ते डॉक्टर रावल.
एंड डॉक्टर संदीप जुल्का इंदौर से, वो एंडोक्रिनोलॉजिस्ट.
अरे संदीप तो मेरा बहुत अच्छा फ्रेंड है.
मैम एक क्वेश्चन आ रहा है, चिराग कौशिक जी पूछ रहे हैं, एंड कैन यू आंसर फॉर प्रेगनेंसी, फॉर विमेन, फॉर चिल्ड्रन, विटामिन डी हम कब लें, दिन में या रात में? रात को लें तो कोई दिक्कत तो नहीं है?
I don't think it matters. You can take any time. मैं एक हैप्पी वॉक वीडियो वॉच करती हूँ, और आई डू दैट हैप्पी वॉक. जब टाइम नहीं होता है तो घर पे ही वॉक करती हूँ. तो उसमें वो लेडी बोलती है कि व्हाट इज द बेस्ट टाइम टू वॉक, and there is no best time. Whenever you can walk, that is the best time for walk. So I think vitamin D also, whenever you remember, please take it. Otherwise you'll say that kal lenge, parso lenge, and then you tend to forget.
गणेश शंभोरे जी भी प्रेगनेंसी में कभी-कभी क्या होता है, स्पेशली फर्स्ट ट्राइमेस्टर में या 13-14 वीक्स पे मॉर्निंग सिकनेस होती है. दैट इज बिकॉज ऑफ इंक्रीज्ड प्रोजेस्टेरॉन लेवल्स इन द मॉर्निंग. तो बहुत सारी लेडीज पसंद करेंगी कि मैं दोपहर या रात को ही गोली लेना चाहती हूँ ताकि सुबह कोई मुझे तंग ना करे. सो दैट इज अलाउड. आई मीन
that is perfectly fine. That's perfectly fine.
रेखा बिठारा मैम का एक सवाल है आपसे. शी इज 63 इयर्स यंग and she has thyroid also. एक लेग में पेन है. She is taking calcium 500 milligram. So is that enough at age 63? And कितनी देर के लिए लें?
I would say कि उसको बढ़ा दें, आप डबल कर दें टैबलेट को.
500 सुबह शाम कर दें रेखा जी.
Yes.
And vitamin D जैसे अभी बोला 60,000 units once a week for maybe 3 months, and उसके बाद once a month लगातार लेते रहें. आपको मैं
और कैल्शियम की टैबलेट्स में थोड़ा विटामिन डी रहता ही है, जितनी भी आप कैल्शियम की टैबलेट्स लेते हैं तो उससे भी मिल जाएगा.
मैम रश्मि जी, अंशु सिंह जी, रत्नेश जैन सब आपको थैंक यू कर रहे हैं. रेशमा,
So nice.
डॉक्टर रेशमा इज अ जनरल प्रैक्टिशनर. शी सेज मैम जो आपने पढ़ाया है, दिस इज वेरी हेल्पफुल फॉर मी एंड फॉर माय प्रैक्टिस. सो थैंक यू फॉर कीपिंग अस अप.
So nice. Good.
Actually, Dr. Reshma, I would add my voice to yours. Madam is such a good teacher. My wife is a gynecologist, तो वो fan है डॉक्टर आशा की. तो जब भी मैडम के लेक्चर्स होते हैं, my wife makes it a point to listen.
अरे.
And beauty, Dr. Reshma and Vinay ji, everybody who is logged in with us, the beauty is actually making things simple. तो जैसे करनाल के एक बेटे हैं मैम, उनका नाम है ऋषि वेद व्यास, जिन्होंने वेद लिखे, जिन्होंने महाभारत लिखी. तो उन्होंने वेद का व्यास किया. He structured the Vedas in such a way that simple people could understand. And beauty, I think, ये है कि आप साइंस या मेडिसिन, गायनी को, इनफर्टिलिटी को, विटामिन डी को ऐसे स्ट्रक्चर करें ताकि सब लोग को समझ आ जाए. वो डॉक्टर आशा की खासियत है. आपको अनामिका अनु जी भी गुड इवनिंग कर रही हैं. एंड विनय गुप्ता जी पूछ रहे हैं मैम, विटामिन डी टेस्ट इज वेरी एक्सपेंसिव. So how can we suspect low vitamin D in women? Maybe if you can take women who are planning pregnancy, those in pregnancy, and in the menopausal age group.
Most of the patients, they complain of weakness, pain in legs, all those things. They say they are not feeling good, depression. So these are the patients whom we should really pick up and do vitamin D levels. Routinely, I don't do for every patient, but those patients who are complaining vague complaints, there may be so many vague complaints, and when that is there, then I think it's a good thing to do vitamin D levels. But otherwise, routine supplementation is not a bad idea, and you can go ahead with the supplementation.
I'll agree with what ma'am is saying. There will be vitamin D deficiency OPD में, and some of the symptoms will be थकावट, 2 घंटे काम करके थक जाते हैं, पैदल तो जितना मर्जी चला लो पर सीढ़ियां चढ़ते हुए दिक्कत आती है, सो डिफिकल्टी इन क्लाइंबिंग स्टेयर्स। छोटे मोटे काम करा लो हाथ के, वो ठीक हो जाएंगे, पर अगर 5 किलो की बाल्टी उठानी है और बाजुओं से ऊपर करनी है, वो नहीं होता। So maybe the housewife will say that I'm able to do most of the work in my kitchen, but the shelf that I have, that is a bit high, and I cannot, take things down from that high hanging shelf. Neither can I
Yeah,
put
that
things.
proximal myopathy is there.
एक और चीज आती है कि जब मैं मंदिर जाती हूँ या गुरुद्वारा साहब जाती हूँ या मस्जिद में जाके मुझे नमाज पढ़नी हो, तो उठा बैठा नहीं जाता, या बैठ तो गए पर उठने में दिक्कत आती है। एंड मेनी ऑफ आवर पेशेंट विल से कि मुझे शर्म आती है गुरुद्वारा साहब जाते हुए, बिकॉज आई कैन नॉट बाउ, एंड देन आई नीड सपोर्ट फ्रॉम समवन, टू माय डॉटर इन लॉ टू पिक मी अप, एंड बिकॉज ऑफ दैट आई जस्ट डोंट गो टू द टेम्पल और द गुरुद्वारा साहिब एनीमोर। That is something we should ask all ladies, because होता क्या है, सपोजिंग कोई लेडी है जो नमाज नहीं पढ़ पाती, वो किससे बात करेंगी? वो तो बहुत शर्माएंगी मौलवी साहब या मौलाना साहब से बात करते हुए, तो शी विल टॉक टू हर सिस्टर और हर सिस्टर इन लॉ। अब वो भी सेम एज ग्रुप की हैं, 90% है, उनका भी खाना पीना सनशाइन एक्सपोजर उतना ही है, तो दोनों सेम बीमारी में हैं। तो सपोजिंग आई गो एंड आई टेल मैम, मैम मेरे राइट क्लेविकल में या राइट कंधे में दर्द है, मैम विल आंसर कि मेरे तो लेफ्ट में है। सो यू नॉर्मलाइज द डिजीज, भी ये तो चलो सभी को ही होता है। And then the end result is nobody is going to the mosque and nobody is offering namaz, या रमजान में तरावी प्रेयर नहीं ऑफर कर रहे। तो if you ask the patient, आप नमाज पढ़ पाती हैं, आप गुरुद्वारा साहब जा पाते हैं, मंदिर में जाके जिस तरह से आप माथा टेकना चाहती हैं आप टेक पाती हैं, especially if it is a lady doctor speaking with a lady patient in privacy, the answer will come 99%, how did you know? ये तो I have been wanting to tell somebody for the last 4 years and I was so shy, I was so ashamed. तो उसका आंसर है हम आपको विटामिन डी देते हैं ना, and then just wait for a few weeks and you'll be fine. So I think that history taking also we should be taking proactively. साइंस में जैसे मैम ने कहा कभी कभी दर्द होती है, तो आप हड्डी दबा सकते हैं, यू कैन प्रेस द रिब केज और यू कैन प्रेस द टिबिया अबव द एंकल। तो अगर दबाने से दर्द होता है बोन में, दैट इज बोन टेंडरनेस, so there are many causes, but the commonest is vitamin D deficiency. तो vitamin D देके देखें, that pain will disappear. Ma'am, so many people still complimenting you, Neera ji, Ajab Parihar, and Dr. Pawar has given the answer for the 3-year-old boy, 800 units per day. तो ये हमने एक्सपर्ट ओपिनियन ले दिया बेबी कौशिक के लिए, चिराग कौशिक के बेटे हैं। So, कौशिक, छोटे कौशिक साहब को भी गुड हेल्थ विश करते हैं। 800 यूनिट्स पर डे है डोज। मैम, दिस क्वेश्चन इज फ्रॉम नीरा जी, पेशेंट हैविंग फ्रीक्वेंट फ्रैक्चर्स, तो इसमें कैल्शियम विटामिन डी की डोज बढ़ाएंगे क्या?
मेरे ख्याल से इस टाइप के पेशेंट में इट वुड बी वर्थ चेकिंग द कैल्शियम लेवल्स, इट वुड बी वर्थ चेकिंग द विटामिन डी लेवल्स, और दूसरी चीज़ें भी चेक करना चाहिए। इट वुड बी वर्थ सीइंग एन एंडोक्राइनोलॉजिस्ट, बिकॉज समटाइम्स देयर मे बी सम अदर endocrinological problems also. I think parathyroid causes moans, groans, and yeah. So maybe it would be worth seeing some expert. But yes, please do vitamin D levels and calcium levels in these patients. Just blindly don't do the things, because everything, there is one limit. Beyond that, I think we should really investigate the patient properly, because these days we work in evidence-based medicine era, and we have to diagnose the problem and then go ahead.
So osteoporosis would be calcium vitamin D is necessary for hygiene, same dose,
Yeah,
but
yeah.
एक्स्ट्रा भी चाहिए होगा। One thing we can do, नीरा जी, जो फ्री ऑफ कॉस्ट है, इट इज कॉल्ड फ्रैक्स टूल, FRAX। आप गूगल पे जाएं, फ्रैक्स डालें, FRAX, दैट इज फ्रैक्चर रिस्क असेसमेंट टूल। सो इसमें आप डाल के अपना एज, जेंडर, इंडियन एथनिसिटी डालेंगे, एंड बाकी डिटेल्स पता है तो लिख दें, नहीं पता तो भी कोई दिक्कत नहीं. दैट विल टेल द रिस्क ऑफ फ्रैक्चर, इट विल आल्सो टेल द रिस्क ऑफ ऑस्टियोपोरोसिस. एंड यदि वो रिस्क हाई है, दैट मींस यू शुड एक्चुअली बी कंसल्टिंग एन एंडोक्रिनोलॉजिस्ट. मैम एक
And even
क्वेश्चन
it is
है.
worth doing bone densitometry also in such cases. That will also guide you for the treatment.
Diagnostic will be
Because
DEXA.
in initial stages, vitamin D and calcium are okay. But if later on it is required, then you can give bisphosphonates. New medicines are available, so they can be given. Though they also have their own limitations, have to be given for one particular time. But yes, they can be given.
रेखा जी आपको थैंक यू कर रही हूँ. रवि जी का क्वेश्चन है, मैम आफ्टर मेनोपॉज कैन वी टेक विटामिन डी लाइफ लॉन्ग?
Yes, already it is required. So yes, you can take. Initially, you can take weekly, and then you can take fortnightly or once a month. But yes, it's worth doing that.
अमित मेहता जी का क्वेश्चन है, which मैम if you can take any dental correlation of vitamin D deficiency?
होना तो चाहिए, मगर सर शायद आप ज्यादा बता पाए उसके बारे में.
वो हाँ, जो मैम कह रही है होना तो चाहिए अमित भाई, और हमारे डेंटिस्ट लोग भी लिखते हैं, बट जो स्पेसिफिक आंसर है वो वी विल गेट सम एक्सपर्ट टू टेल अस. बट आई एम श्योर दैट दे मस्ट बी यूजिंग विटामिन डी इन मेनी पेशेंट्स.
बस मुझे
अरुण
एक जो
देशमुख.
पता है वो ये पता है कि जो हम ये बिस्फॉस्फोनेट्स 2 to 3 years से ज्यादा देते हैं तो उसमें जरूर मैंडिबुलर नेक्रोसिस होता है. तो कभी भी कोई, कितनी बार लोग ब्लाइंडली लेते जाते हैं, अरे हमारे डॉक्टर ने कहा था, हम 6 साल से ले रहे हैं, वो एम्प्टी स्टमक लेना होता है और लेटना नहीं होता है, वो वाली दवाई. एंड देन यू रियलाइज दैट, एंड दे हैव नॉट रियलाइज दैट दे हैव गॉट दिस, दे कैन गेट दिस प्रॉब्लम. सो हर चीज सोच समझ के लेना है.
One question from Dr. Veera Kaila Lokesh, from Dr. Lokesh. What is the best time to get vitamin D from sunshine? Some people say early morning 6 a.m. to 9 a.m., while others say midday 11 a.m. to 1 p.m.
सर ये तो आपको ही आंसर करना पड़ेगा, मैं भी पूछना चाहती हूँ ये वाला क्वेश्चन.
Lokesh ji, the afternoon time is the best actually, around 12 to 3. जो सूरज की किरणें होती हैं, the rays of the sun, उनमें अल्ट्रावायलेट रेडिएशन होती है, तो जो एंगल होता है, that angle is the best at around midday, and that is when you need the vitamin D. And जो आपने पॉइंट रेज किया लोकेश जी, that answers the comment of Dr. of अरुण देशमुख जी, जो कह रहे हैं कि I am in a taxi 8 a.m. to 10 a.m. तो सनलाइट होता है, but that is not enough, it will not suffice. एक
और हम
स्टोरी
लोग
थी.
वो वाली सनशाइन में रहना भी तो नहीं चाहते हैं. वो वाली सनशाइन बहुत तेज होती है, उस वक्त गर्मी लगती है और उससे हमारा टैनिंग होता है, तो ये भी तो हमारी इंडियंस की प्रॉब्लम है.
दिक्कत है. वी आर ब्लेस्ड विद द सन, बट वी आर हीलियोफोबिक. स्टोरी याद आती है मैम, जहाँ पे राजा ने, वो खुश रहना चाहते थे, तो उन्होंने अपने वजीर को बुलाया और अपने डॉक्टर्स को बुलाया, वैद को बुलाया, तो जी मैं खुश नहीं हूँ. तो वैद साहब ने बोला, यू फाइंड द शर्ट ऑफ अ हैप्पी मैन, तुम एक खुश आदमी की कमीज ढूंढो. तो वो ढूंढने निकले और पूरे देश में, पूरी जागीर में कहीं उनको कोई खुश आदमी नहीं दिखा. फाइनली जो उनके आर्मी वाले थे लोग, उन्होंने ढूंढा कि जी एक आदमी विसल कर रहा है और बड़ा खुश है. तो जाके देखा तो वो अपनी भैंस चरा रहा था, बट उसके बाद ही वाज हैप्पी, he and his buffalo in the forest, but he didn't have a shirt, so there was no shirt. So the point is कि sunlight exposure without a shirt, if that is feasible.
Yes.
मैम एक क्वेश्चन आपके लिए लोकेश जी का. हैव यू in gynae practice, people are taking calcium and vitamin D continuously, the ones who are on follow-up. So have you ever personally encountered vitamin D intoxication?
No, not yet.
Yeah.
Not a single patient.
Lokesh, एक आध बार देखा होगा, and the etiology is a elderly frail lady who has been given vitamin D injection 6 lakh units every week for fracture correction, and then she took it for 6 weeks. Maybe the orthopedic surgeon gave her 1 injection, but she ended up taking 6 injections. तो एक दो पेशेंट्स हैं ऐसे, अदरवाइज ज्यादा नहीं है. रिंगवर्म का दुर्गा प्रसाद जी, ऑनेस्टली नो आइडिया, बट रिंगवर्म इन्फेक्शन is more common in people with malnutrition. And जब हम malnutrition की बात करते हैं, we speak of protein energy malnutrition classically, proteins and carbohydrates. Now in India, carbohydrate malnutrition is not so common. I mean, सबको अनाज मिल जाता है खाने को. Protein malnutrition बहुत common है. मगर उससे ज्यादा एक और चीज जो common है, it is called hidden hunger. Hidden hunger means micronutrient deficiency, malnutrition. So that is vitamins and minerals. So actually, vitamin D deficiency is a hidden hunger. Ringworm infection is more common in malnourished children. So it may not prevent ringworm, but when you are correcting the hidden hunger, automatically the immunity will go up. And one question, this is from a dentist again. I think Dr. Himani, both of us may not be able to answer, but आपका question raise करते हैं. Himani Chaudhary ji is a practicing dentist in Bhilwara in Rajasthan. Thank you for joining us, madam. In cases of amelogenesis and osteogenesis imperfecta in pediatric patients, should we prescribe vitamin D along with calcium syrups separately? So I can take that. The calcium syrup usually will not contain enough vitamin D, and you will have to give vitamin D separately. The average dose would be something like 60,000 units once a month. And ma'am, again from Dr. Lokesh, one question. CA breast and CA ovary, in your practice you screen and you diagnose. Do you feel that CA breast, CA ovary are also linked with vitamin D deficiency?
See, I was going through a literature and where they said that on sonomammography or mammography, where they found more abnormalities. Many patients with vitamin D deficiency had more abnormalities. That is the only association I could find. About ovarian cancer, I have not found any, means I have not read anything that there is a correlation, but maybe now I will try to search. About fibroids and other things I do know, but about ovarian cancer particularly, I have to really read, and then on that, I think I can answer your question.
And our colleagues in oncology are using vitamin D along with their chemotherapy as a preventive measure, as adjuvant therapy. मैम और खूब सारे क्वेश्चंस आ रहे हैं, अगर आप इजाजत दे तो लेते हैं. एक मैं लेता हूँ रत्नेश जैन जी का. डायबिटीज के मरीज को विटामिन डी जरूर लेना चाहिए. आंसर इज यस, जैसे बाकी सबको. विटामिन डी में खासकर डायबिटीज में, खासकर टाइप 1 डायबिटीज में बोन्स वीक हो जाती हैं. एक बहुत प्यारा कमेंट है मैडम आपके लिए, दैट इज फ्रॉम अरविंदर कौर जी, एंड दैट इज थैंक यू फ्रॉम द बॉटम ऑफ माय हार्ट.
That is so sweet, so sweet. Thank you so much, Arvinder ji.
And Rashmi ji पूछते हैं, what is the ideal level of vitamin D required for women in menopause?
अभी अपन ने डिस्कस किया था, यदि if she is above 60, then it would be better to go for 800 units. And because osteoporosis starts right from 60 years, and it becomes more obvious by the age of 65 in women. Though men are a little bit lucky, because for them osteoporosis starts a little bit late, and it is very obvious by the age of 70.
Maybe we should aim for anything between 30 to 100 nanogram per ml, and roughly 50, 60, that kind of a level would be safe for postmenopausal women. एक क्वेश्चन मैं लेता हूँ खदीजा जी का, which is symptoms of vitamin D intoxication. So headache, constipation, these will be the commonest. Headache and constipation. The simplest way, if you want to screen and you can't do vitamin D levels क्योंकि वो महंगे हैं, you can do a urine routine for calcium crystals. If you find calcium crystalluria, now it can be because of renal stone, it can also be because of vitamin D overdosage. तो फिर vitamin D बंद कर देंगे हम. So calcium crystals is something that you can do in a 10 or 20 rupees test. And the treatment is first of all hydration. तो पानी ज्यादा पिलाएं. पेशेंट को एक्सप्लेन करें कि अगर आप पानी ज्यादा पिएंगे तो जो भी कैल्शियम है बॉडी में जो जमा हुआ है वो यूरिन के रास्ते बाहर निकल जाएगा. यू विल फील बेटर, एंड पानी पीने से आपकी कॉन्स्टिपेशन भी बेटर होगी. So that is the simplest treatment. मैम आपके साथ बात करते करते पता ही नहीं चला 45 मिनट्स हो गए हैं, एंड ये छोटा सा विटामिन डी, छोटा सा टॉक, एंड देयर आर स्टिल सो मेनी क्वेश्चंस कमिंग अप. But it's been great
questions. Very nice, and I enjoyed communicating with you. It has been a very good dialogue, and even I forgot my pain, and I'm continuously absorbed in your dialogue, so it's really good. Thank you so much.
सबकी तरफ से मैम ऑल द बेस्ट. और एक आपको एडवाइस आ रही है स्वप्ना जैन जी से. मैडम इज अ हेल्थ एडवोकेट फ्रॉम वेल्लोर इन तमिलनाडु, और वो कह रही है मैम आप हल्दी वाला दूध
जरूर जरूर, बिल्कुल बिल्कुल. मेरी मम्मी की याद दिला दी आपने, बहुत बहुत धन्यवाद.
ताजी हल्दी होनी चाहिए, एंड Actually, if you get fresh healthy and then you sort of grind it and you do it every week, so that actually gives good results.
But fresh haldi is available only during winters. No, now fresh haldi will not be available. So,
Ma'am, अगर good quality चाहिए हो, you can try haldi which comes from the hills. So I don't remember the name of the website now, but if you go and look for Himachal Pradesh organic products,
okay,
and
I'll do that.
I'll try to get the message across to you वो website कौन सी है.
Sure,
You will
sure,
actually
sure.
find कि इतना सा एक दाना जो है that will
हाँ,
give more color to the vegetable or the sabji than the routine haldi that we are using.
अरे वाह, yes.
And amba haldi is something जो of course preserved होती है. Amba haldi is again
हाँ,
something that comes from
अम्बा
the
हल्दी,
hills.
हाँ, yeah.
विनय गुप्ता जी पूछते हैं vitamin D and thyroxine, so no link we can take together. There's no impact of vitamin D supplementation on thyroxine absorption. With this, ma'am, it's been great having you with us. हमारे
Thank you.
साथ आज प्रतीक और बतूल हैं backstage. If you allow, ma'am, could we show you and could we share a
Yes.
certificate of appreciation for you, ma'am, please?
Thank you so much. That's really lovely and very professional. बहुत अच्छा है और बहुत ही grand है.
नहीं, thank you,
वैसे
ma'am.
भी मैं डॉक्टर के अग्रवाल की बहुत बड़ी फैन थी, हूँ अभी भी हूँ, तो it's so nice to be on this platform.
सर के अब 3 years हो गए. हल्दी वाला लिंक फिर रश्मि जी मैं नेक्स्ट केके मेड टॉक में पक्का शेयर करूंगा. It comes from Himachal Pradesh. It is a startup and I don't remember the name, otherwise मैं बता देता. So I'll certainly
बिल्कुल
share.
बिल्कुल. Sure.
And आप सबसे अगेन मोर कमेंट्स. आपका ऑरा बहुत पॉजिटिव है मैम. एंड विनय गुप्ता जी की आंखें भी अच्छी हैं इसलिए उनको पॉजिटिव है. उनको सब कुछ दिख रहा है. एंड आपकी स्माइल इवन दो सर्टेनली द क्लेविकल फ्रैक्चर डज हर्ट, बट तो भी आपने स्माइल बनाए रखी है हम सबके लिए. एंड यू बीन सो
Thank you so much, and really thoroughly enjoyed the show, and I would be happy to come anytime whenever you invite me. Thanks.
Certainly, ma'am. KK Med Talk is a daily show 7 to 8 p.m. हमारा काम होता है to spread health awareness और मैं होस्ट करता हूँ ये सोमवार और वीरवार. तो we look forward to having ma'am on the show with us again. And आप सबको धन्यवाद, शुक्रिया, मेहरबानी, and जय हिंद.
बहुत खूबसूरत. Thank you. Thanks.
जय हिंद.
जय हिंद.